Shmai, Chris Dawson Morris Dwi. Hello, I'm Chris Dawson Morris and I'm here at Ysbyty yn Nile Bevan today to say that I'm really pleased that the Integrated Medium Term Plan, our 3-year plan for the organisation, has been approved by Welsh Government. It's a plan that sets out our aims, ambition and objectives for the next few years, and we're going to tell you a bit more about it today. The overarching aim of the plan is really about reducing the health inequality experienced by our population. We've got a 16-year gap in healthy life expectancy between some of our areas of our population, and we don't think that's acceptable as an organisation. So we really want to focus on what we can do to help our population be as healthy as possible and live as well as possible. The plan itself is separated into 5 sections, and that looks across the life course and looks at people at how they live their lives and how they want to live their lives. So that first chapter is really about supporting people in pregnancy and those early years of life. So we've got actions in there around supporting people in pregnancy to be able to be as fit and healthy as possible, support those really crucial early first 1,000 days of life. So programs about how do we support people to get the right nutrition into children and their babies, and how do we give people good support and advice in those early years. Crucially as well, those early vaccination and immunisation programs that we can support our youngest people to be as safe as possible. The next chapter looks at children and young adults. Again, they're really crucial years. We've got a particular focus in the plan about young adult mental health, because we know it's young adults who particularly suffered during the pandemic with loss of years of education, opportunities to socialise, and opportunities to really grow as individuals, and missing out on those crucial opportunities. So the plan really focuses on working in partnership with the charities and with local authorities in terms of support services for young adult mental health. And really importantly as well, those transitional years when sometimes children really struggle in the movement between children's services and into adult services, that we make sure we've got seamless care for people as we move through those ages. The third chapter of the plan is about supporting adults to live well in our population. And this is a real challenge for us as an organisation. As you'll see in the news and see everywhere, waiting lists and waiting times for our services are growing. And we know we're not able to see people in the time that we'd really like to see them. And so it's really crucial that we have a focus on what we call planned care or elective services in the plan. Now, our commitment is to try and support you to live as well as possible. We know that people are still going to have to wait longer than we would like for our services. And that's for many reasons, the backlogs that have been caused by the pandemic, but also really importantly, the challenges of our workforce. Our staff have really gone the extra mile over the last few years. So the opportunity to recover, rebuild their skills and get that training back into their core areas of work is really important. So our commitment in the plan is to do what we can to increase our capacity to deliver planned care, but also to look at how do we make sure we get you the right information about how long you might wait, and also information about how you can support yourself to live well while you wait. And that's our commitment really. The fourth chapter in the plan then is about our older adult population. And this is an area where we know we need to improve our services. We know that older adults probably spend too much time in our hospitals and have what we call a long length of stay. And we really have challenges in supporting people in that transition out of hospital back into their place they call home, be that their own individual home, be that a care home, or be that other types of supported living. So it's really nice to be here at Yab today, one of our community hospitals, where we've got fantastic services for our older adult population, where we're able to give people really great, what we call re-ablement services, supporting people to build back up the skills in terms of moving around their home, getting fitter and well, and getting that physiotherapy support to be able to live well in older life. What I also set out in those plans is how we can support people to live well at home. How do we work in partnership with social care and again with local authorities to keep people well in their homes and keep people well in the community so they don't need to come into our hospitals. But if they do need to come in, how do we make sure we see them and treat them as quickly as possible and get them home again and back into their communities to be with their family. The final part of the plan then is about end-of-life care. Now we know in the last 2 years the experience at the end of life hasn't been good enough. Really sadly, people have died in our hospitals without that support network around them, without their families sitting by them. And you know, our staff have been overwhelmed by the opportunities and the experience of sitting down, holding an individual's hand at the end of life. So it's really crucial that we focus on good end-of-life care. That means supporting people to plan well for their death through things like advanced care planning, but also supporting people through bereavement services and our care after death team, and making sure those experiences and those memories of the end of life are a real true experience and a real positive experience as it can be at that period of life. So that's our plan, really focusing on those 5 areas across the life course. Now, overarching theme is of course around reducing health inequality, but also meeting your needs as our population. So the plan is published on our website. We'd love you to go and read it and take a look at what we're up to over the next few years. And over the next few months, we'll produce a series of these videos and more information about the core elements of the plan. So thank you for listening, and I hope you enjoy reading the plan.